Fun fact, did you know that your skin is your body's largest organ? And when you think about it, we put our skin through a lot. We cool it, heat it, burn it, pick it, scratch it, hurt it, and cover it in all sorts of different things. We don't even really think about it until something appears that we've never seen before. A lump, a rash, acne, or even losing your hair. That's when you should probably see a dermatologist. And today, I'm meeting up with one to find out what it is that they do and why this could be an exciting career for you. Dermatologists are specialist trained doctors who manage skin, hair and nail conditions. In Australia, dermatologists are experts in the diagnosis and treatment of melanoma and skin cancer. They also diagnose and treat all skin-related conditions, mild or severe, including acne, rosacea, eczema, psoriasis and excessive sweating. Dr. Tony?
Oh, you must be Rebecca.
Yeah, that's me. I've just got some questions on what it's like to be a dermatologist.
Sure, well, would you like to come to the consult room and we'll have a chat?
Sounds great.
Okay, this way. So, what would you like to know?
Well, let's start at the beginning. As a dermatologist, what kind of things do you actually do?
Well, a dermatologist is both a medical and procedural specialist. GPs will refer patients to us who have problems with their skin, their hair or their nails. We also perform surgery, which is both for skin cancer and also for minor lumps and bumps.
What made you decide that you wanted to be a dermatologist?
What attracted me to dermatology was that it's a very diverse career, and I also enjoy seeing patients and knowing that I'm making a difference in their lives.
Walk us through a typical day. What do you get up to?
A typical day consulting will involve seeing patients that are referred to me by general practitioners. On a surgical day, I may begin the morning in the minor procedure room. There I'll do diagnostic skin biopsies for skin conditions, various injections and also minor cosmetic procedures. Then usually in the afternoon I move over to the day hospital where I perform a larger surgery for skin cancer.
I guess you would see some pretty horrible, weird things in your job. What would you say the most challenging part of it is?
I think the most challenging part would be giving bad news to a patient. In dermatology, from time to time we do give bad news related to melanoma.
What characteristics and interests do you think would best suit somebody if they were looking to be a dermatologist?
I think first and foremost a dermatologist needs to be a good communicator. Having an interest at school in the sciences and also having a good interest in public health and community service, which will help you to realise the important community role that a doctor plays.
Okay Tony, now it's time for you to give us the edge. Are you ready?
Let's go.
Alright, if you can list from school to now, what steps does somebody need to take if they want to become a dermatologist?
Well, it is a bit of a long road. After completing Year 12, you need to undertake a medical degree. This can take between 6 to 8 years. Following on from this, you become an intern and resident in the hospital, and this can take between 2 to 4 years again. After that, you're eligible to apply for specialist training, and the dermatology training is for a further 4 years. Most dermatologists have undertaken an additional 14 years of training prior to being specialists.
14 years, that is crazy. What advice would you give to somebody to kind of get through that?
Well look, it's obviously a long road to becoming a dermatologist, but what I recommend is that you have short-term goals and you enjoy yourself along the way.
Okay, and if you could do one thing differently but still end up where you are today, what would it be?
I wouldn't change a thing. I'm really happy with my career as a dermatologist, and it gives you a great work and life balance.
Well Tony, it does sound really interesting, and thank you so much for having a chat with me today.
Thank you. Well Rebecca, that mole looks fine to me.
Awesome news, Dr. Tony, thanks.
You're welcome.
Authorised by the Government of Western Australia, Perth,